of Health meeting. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing. Councillors are participating electronically. I now ask on Tim Brubaker to call the roll.
Thank you. Chair Redmond.
Present.
Councillor Armstrong.
Present.
Councillor Clarke.
Present.
Councillor Erb.
Present.
Councillor Foxton.
Present.
Councillor Galloway.
Present.
Councillor Harris.
Present.
Councillor Jaworsky.
Present.
Councillor Jowett.
Present.
Councillor Kiefer.
Present.
Councillor Lorentz.
I'm here.
Councillor McGarry.
Present.
Councillor Nowak.
Present.
Councillor Shantz.
Present.
Councillor Strickland.
Here.
Councillor Vrbanovic.
Present.
It's all present.
Thank you very much. We'll now have a motion to reconvene in open session. This is moved by Councillor Harris and seconded by Councillor Jaworsky. I'd ask you to please use your buttons to vote yes or no. That's great. This Board of Health is now in open session, and I want to start out with a bit of good news that we got this morning and officially welcome Dr. Julie Emilie and Dr. Ryan Van Meer as Permanent Association Medical Officers of Health. They've been very important, integral parts of our team under the leadership of Dr. Shirley Wang, and that was very good news. Long time coming, but very welcome. So congratulations and welcome to both Ryan and Julie, and we're lucky to have them aboard. Are there any declarations of pecuniary interest? Seeing none, and we have no delegations, I will now go to Dr. Wang for an update on COVID-19. You have the floor, Dr. Wang.
Thank you, Chair Redmond. Kathy Prosh will project my slides. Thank you, Kathy. Okay, so if we go to the next slide. Okay. So our current weekly incidence is up slightly again and sits between 55 and 60 cases per 100,000 population per week. Throughout the month of February, the incidence rate has fluctuated between 45 and 60 cases per 100,000 population per week. While that is somewhat stable, it is still a high incidence rate. We are currently monitoring 408 active cases and 29 active outbreaks. Taking into account interim data, our local average percent positivity is now up to 3%. The reproductive rate represents the expected number of new cases generated by one case. Our reproductive rate is now at 1.1, which reflects that our rates have increased from our lowest point earlier in February. Next slide, please. A little bit about the variants of concern. So provincially, we are seeing an increasing trend in the growth of variants, as we see with the graph at the left. The graph represents provincial data. As of March 2nd, provincially, there have been over 580 confirmed cases and over 3,300 cases who have screened positive. The purple line in the graph represents the increasing percentage of cases among those who have been screened, who have screened positive for a variant of concern. And that percentage in recent days has fluctuated between 20 and 30%. Locally, as of today, we have 10 confirmed cases of a variant of concern, the B11 variant, the one which originated in the UK. And we have 108 other cases who have screened positive for a variant of concern. between February 22nd and February 28th, based on interim data, our weekly percent positivity in our area is approximately 20%. So the growth of variants, both provincially and locally, is in line with what provincial modeling had projected. So the takeaway is that they will continue to grow, but the other takeaway is we can slow their growth by working together. So if you go to the next slide, please, Kathy. Thank you. So our individual actions matter, and we each play an important role in protecting ourselves and one another. While our indicators are not significantly, while our indicators are not increasing rapidly at this time, our rates continue to be firmly in the red zone, and our situation is very precarious as the variants are becoming more prominent locally. The more contacts we each have, the more likely COVID will spread. While variants are more transmissible overall, we also see many cases locally where there hasn't been spread. Variants are controlled the same way as the regular strain is. But with the presence of variants, we need to be more vigilant. It is therefore critical that all residents keep up with the recommended public health measures, the same measures that we have recommended for residents while we were under the stay-at-home order, which are the same recommendations that the province has for our residents, even though we are now in the red zone. That is to stay home as much as we can and to avoid gatherings outside of our immediate household. And that is what we need to continue to do to try to maintain the spread of COVID-19 and its variants to the lowest rates that we can achieve. And thank you. I'd be happy to take any questions.
Thank you, Dr. Wang. Do we have any questions for Dr. Wang? I see none, so thank you very much for that update. And next we have Deputy Chief Hilton for a presentation and a vaccine task force update. Welcome, Deputy.
Thank you, Chair Redmond, and good afternoon. The Boardwalk Clinic in Waterloo will open Thursday, March 4th, and we will begin vaccinating adults 80 years of age and older, followed by others who are eligible as part of the Phase 1 priority populations. We will have an additional clinic location open in Cambridge during the week of March 8th to also serve adults 80 years of age and older and others who are eligible in Phase 1. Both of these clinic locations will offer increased accessibility options for our community members as well, and hope to announce this particular location by the end of the week. The Rona location line of sight to open is the week of March 15th. And again, all eligible priority populations in Phase 1 will receive their vaccinations at this location. Do want to mention that last week the province did announce that individuals experiencing homelessness or precariously housed have been moved into our Phase 1 framework for vaccination rollout. And so currently with our planning, we are looking to leverage our community providers and clinical outreach teams in partnership with the region to offer pop-up clinics at shelter and drop-in centers where we already have existing clinic space. And then the other group that has been moved into Phase 1 is police, specific to active duty frontline police officers who respond to medical calls for service and provide emergency assistance such as CPR and or administer naloxone. The Grand River hospital clinic in Kitchener continues to vaccinate our healthcare workers and those who are 80 years of age and above. And this particular population, we were able to begin vaccination on Saturday. The mobile teams continue to attend a 100% congregate care senior settings for first dose vaccinations. And to date, we have had over 20,000 people pre-register, with over 16,000 in our 80 years of age and older priority populations. All plans continue, and it's very dependent on vaccine availability. We are still currently working with only Pfizer, and we do not know our regional allocation beyond March 15th. And that's the end of my update, subject to any questions.
Thank you, Deputy. Are there any questions for Deputy Hilton? I would just have to say, I don't see any questions. This is very exciting news, Deputy Hilton, and great to see new centers opening in other urban areas in addition to the one in Kitchener at the Grand River Hospital, which was our original one. And just as a small footnote for anybody watching, there is an elevator in the Grand River Clinic for people to access. Councillor Galloway, you have the floor.
Thanks, Madam Chair. With the opening of the Boardwalk Clinic tomorrow, are we going to be able to use the ambulance bay in that facility in the same way we did for testing when we used the facility back a number of months ago?
Deputy Hilton?
In terms of using it for a drive-through?
Yes.
At this point, we're not looking at the location for drive-through. However, it is still part of our planning to ensure that that doesn't get removed from the table. The opportunity exists, but we haven't planned for it at this stage.
Okay, fine. Thank you.
Thank you. I see no further questions, so thank you both very much, Dr. Wang and Deputy Hilton, for the update. Next, we're going to have an update from Mr. Aldo Franco. He's Manager of Health Protection and Emergency Services at Waterloo Region. Welcome, Mr. Franco, and you have the floor.
Thank you. It's more of a verbal update around the enforcement campaigns, the ministry, multi-ministry provincial enforcement campaigns. As you know, we've been working with the provincial multi-ministry teams since November. We had a campaign in November when the provincial framework was first implemented, and during that 2-week campaign, we actually moved colors 3 different times, 3 different zones, and so there's a lot more education at that time than enforcement. And in January, we had a second campaign during the shutdown order, which focused on big box stores and retailers that were open. And there was still had I think over 50% compliance rate, and some enforcement was done. But in that debrief, after that debrief, we had looked at another campaign in March, penciled in. So just yesterday it was confirmed that we would have a third campaign in the region of Waterloo from March 11th to the 16th. So it's just shy of a week, but the focus will be on some of those businesses that obviously have reopened now, and maybe look back at the list from November when there was a bit more fluctuation in the requirements, and maybe revisiting some of those where there were some contraventions, but more education given at that time, and also looking at some of the businesses that may have been visited in January that could use another follow-up. So that is being planned in conjunction with our municipal enforcement partners and the provincial multi-ministry enforcement team.
Thank you very much. Are there any, we have some questions. Councillor Jaworsky, please go ahead.
Thank you. Through the chair, I guess alphabetical order has its advantages today. To Aldo. What sort of things are you seeing there? I'm not looking for specifics on businesses, but the broader public is listening today. What are some of the things that you would say to business owners that they really need to pay more attention to help us get through this, so that there's less enforcement or less education that needs to be done? Well, maybe a couple of things.
Just reviewing some of the concerns or the flags that were noted from the summary that we received from the province. A lot has to do with around the safety plans that they have in place to make sure they're up to date and available, screening employees, and some of the precautions that we see around the staff areas, is to make sure mask wearing in staff areas, because I think, as been mentioned before, the businesses are doing a great job. They want to stay open. They want to do the right thing, and especially in the public areas. And we want to continue that on the back of the house and the employee areas as well. So those are some of the focuses that the multi-ministry team does look at, and some of the trends that we've also seen.
Excellent. Thank you very much, Aldo.
Thank you. Councillor Lorentz, you have the floor.
Thank you, Madam Chair. Good to see you, Aldo. So I listened to your presentation, and it to me, I know this is not easy stuff, and it seems a little bit like doom and gloom, but I think comparative to where we were this time last year, when it first started, and where we are today, it has to be totally night and day when it comes to dealing with businesses that are open and operating. I mean, I certainly notice a big improvement from the beginning, when everybody was just kind of scrambling, trying to figure out what it would take to stay open. And now it seems a lot of order and calmness, and very definite, if you don't have a mask, you're not getting in. And when you walk through the door, please put some sanitizer on your hands, sort of thing. Am I wrong, or is that kind of what you see and your staff see?
Anecdotally, and from some of the information we received from the ministry and some of the previous campaigns, there is a bit more understanding, and they call it enforcement campaign, but a lot of it is education. And unless they see something that is really off the charts, they tend to use the education component more, as we do. I do believe there's a bit more of an understanding now that we've been in the framework since November, although it's changed a little bit. So I would agree that there is more of a understanding what has to be done. It's just a matter of execution sometimes.
Just one last question, if I could, Madam Chair.
Absolutely.
Complaints. Do we get a lot of complaints? Do you get a lot of complaints, people phoning in and saying, this is what they saw? Or is it basically the enforcement is just kind of random? You kind of know, what type of business you're looking for?
The provincial campaign is more random. We do provide some input as to maybe some areas where we see higher risk or some concerns have been flagged. As far as complaints go, I don't have any numbers on me, but we do tend to see an increase in complaints when we have color changes or a change where we're at, just as you said, so people try to understand. And sometimes, people want to do the right thing, and they want to let us know if they see something off. I think the complaints would be safe to say they've been steady, but we do see a spike when we do experience a change in the framework or in the legislation.
Okay.
And it's just a matter of adjustment. I think it's a matter of an adjustment. Businesses are trying to adjust with the changes.
Thank you, Councillor Lorentz. I see Mrs. Fletcher has turned her camera on. Would you like to add to Aldo's answer, Chris?
Sure. With respect to your question, Councillor Lorentz, certainly Aldo is absolutely correct. Is every time we change a color zone or there's a change in how the legislation is written or interpreted, we've seen a large increase in the volume of calls that come in. And mainly those calls are mainly questions about how does this apply to me? So, businesses are well aware now of where they can get information and how they get information, and they make use of the email channels and the phone channels quite regularly. But I can say that even last week we had 139 calls around the Reopening Act. So we continue to have a large number of calls, and you also get calls and concerns raised from, through constituents from time to time. Some of those make their way to us. Sometimes they don't. But we still see that huge influx when we might drop down to around 80 calls a week. And then if we get a color change, when we got the last color change, we went up to 239 in a week, right? So those are the kinds of things that happen with respect to the calls under the Reopening Act and any enforcement activity.
Great, thank you.
If I can, I just had a quick look. So the week of February 18th and 24th, just after that, we got back into red. We had 272 what we would call complaints and/or requests activities. So people calling in for information and/or providing a complaint. So it was pretty active.
Thank you, Councillor Lorentz. Any further questions? Okay, thank you, Aldo, and thank you, Chris. That was great. I don't see any more questions. Colleagues, the next agenda item is the Emergency Shelter and Harm Reduction Integration Initiative. This is being presented by staff for information. And I did see Karen Quigley-Hobbs on. I don't know, Karen, if you want to introduce Grace and Chris, or we'll let them introduce themselves. Okay, Grace is Manager of Harm Reduction and Infectious Disease. Grace, welcome, and Chris, welcome.
Thank you, and good evening, members of the Board of Health. I do have some slides that Kathy Proch is going to share for me. Thanks, Kathy. So as you heard, I'm here with Chris McAvoy, Manager of Housing Policy and Homelessness Prevention and Housing Services. Together, we're going to share with you some information about work underway to examine harm reduction needs within the region's emergency shelter system. So I'll start off by, go ahead, Kathy, to the next slide. Thank you. So I'll start off with a little bit of background and some context. As you're well aware, the opioid crisis continues to be a complex and evolving health and social issue across Canada and Ontario, and of course, locally here in Waterloo region. In June of last year, Ontario's chief coroner announced a 25% increase in suspected drug-related deaths between March and May of 2020, compared to the monthly median in the year prior. The increase in drug-related deaths is believed to be driven by a combination of factors, including an increasingly toxic, unregulated drug supply, barriers to access to harm reduction services and treatment, and physical distancing requirements leading to more people using drugs alone. For 2020, the Waterloo Region Integrated Drug Strategy reported the highest number of suspected overdose-related deaths since overdose reporting began in this region. Waterloo Region Police Service data reported 98 deaths in 2020, which represents a 56% increase from the 63 deaths reported in 2019. And while we know that overdoses occur in many different settings, substance use issues, including overdose, continues to be a challenge for emergency shelter providers, both before and during the COVID-19 pandemic. So now I'll invite Chris to speak to the next slides.
Excellent, thank you, Grace. You can move forward a slide ahead, please. So I'm going to provide a little bit of background and context on what the Emergency Shelter and Harm Reduction Integration Initiative is all about. So this project aims to reduce harms associated with substance use in emergency shelter settings, including opioid deaths and their impact upon shelter participants as well as staff. Harm reduction needs assessments. This is ultimately a harm reduction need assessment within the emergency shelter system, which will be conducted to describe substance use related challenges facing emergency shelters throughout Waterloo region and hear about strategies that staff are using to support participants as well as themselves. We know that emergency shelter staff are trained in harm reduction approaches and responding to overdoses. However, we continue to hear from shelter providers and their staff that the continual and increasing number of fatal and non-fatal overdoses is having a significant and traumatic impact on shelter participants as well as direct service staff. Direct services staff, shelter staff are often the first responders to an overdose. And through this project, we want to ensure that they have the supports, the training, and the resources that they need to effectively respond to and recover from an experience of responding to an overdose. Next slide, please. So there are four main objectives of this initiative, and they are to bring together key stakeholders in the shelter and harm reduction sector to consider the unique challenges facing staff and participants related to substance use, overdose, and their impacts. It's also an objective to work with the shelters to create a harm reduction needs assessment that will lead to the creation of an inventory of current harm reduction supports, describe the challenges facing shelters pertaining to substance use and harm reduction, and identify any gaps in harm reduction services and supports that are currently available. Another objective is to identify the estimated number of fatal and non-fatal overdoses that occur within shelters, as well as identify harm reduction supports and strategies that may help address the substance use and related harms and the gaps in current services that we see. Next slide, please. So I'll also add that consumption and treatment services and safe supply initiatives are strictly regulated programs under federal and provincial governments, and therefore they're beyond the scope of this project. These would include legally permissible options that could be implemented to address current challenges. So in terms of the next steps, we have a lot of work to do over the next couple months. So in March, we intend throughout the month to conduct the needs assessments with shelter staff, as well as executive directors and other staff in emergency shelters, as well as other community providers. Then in April, we will run through an analysis of that information and hope to share findings back in April and May. And then in any implementation around the findings of the results will start in May and June and then continue on later. And that concludes our presentation.
Thank you, Chris. Very interesting, and I see hands popping up. Councillor Jaworsky, please go ahead.
Thank you. Through the chair to Grace. You know, it's certainly very sad to see the prevalence, the increase in rate of fatal overdoses due to opioids. What I'm wondering, and I doubt you have this data, but I thought I'd ask anyways, I was wondering about the prevalence of usage. So although certainly fatal overdoses have skyrocketed by 50%, what about the prevalence of usage? Do we have any data on that? Has that been increasing potentially due to the pandemic, the stresses of it and that? I'm just wondering, do we have any data on that? Does anybody? Just wondering if you have any thoughts on that. Thank you.
Yep.
Grace, do you want to take that?
Yep, through you. The short answer is no, we don't have data on substance use itself. And typically that's been really difficult and challenging information and data to get, largely because we have a sense of substance use practices amongst those who are willing to share that they're using substances. But because of, you know, substance use being something that people often hide, we don't, you know, it's really a challenge with data collection everywhere, not just here in Waterloo region. So that's a real challenge. What I will say is that through this work, we are aiming to, as Chris mentioned, really get a good sense of those non-fatal overdose numbers. Those are typically pretty challenging numbers to collect as well, because often, and especially with the distribution of naloxone in the community and the wide distribution of naloxone in the community, we don't always get 911 calls associated with those non-fatal overdoses. But what we do know is that they are leading to incredibly traumatic experiences, both for the people experiencing the overdoses and those responding to the overdoses and those witnessing those overdoses. So we want to get a strong handle on those numbers so that we can compile those, really get a sense of what's happening in our community.
Okay, thank you. And thank you as well, Chris, for your great presentation.
Councillor Jaworsky. Councillor Jowett, go ahead.
Thank you, Chair Edmund. So it's been a bit of a rough month, February. I think, Chris, I can't thank you enough for taking those calls the way you have and the way you mobilize teams to get out there and answer those wellness calls. I guess I want to ask Grace, are the folks that are overdosing, are we not getting them to come in? I mean, I'm getting these calls for frostbite concerns, and I'm so incredibly worried about these folks. And is it is it because they're doing the drugs and we can't get them to come in, or like, is there some kind of connectivity between people who are doing drugs and getting frostbitten? That's
so Grace.
I know it's a bad time right now.
Yeah, it's through you, Chair Redmond. What we know is that there's, because of the stigma and shame around drug use, and because for many people and for various reasons, there's some mistrust in the regular healthcare system. When there's a non-fatal overdose, there tends to be an unwillingness to call 911 in those scenarios. I think locally we've done a really good job at talking about the Good Samaritan Overdose Act along with our colleagues in the police services. So I think that information is out there. I mean, the fact that naloxone kits are saving lives, I think, is a really positive thing for us. But we still continue to have challenges with getting folks to call 911, and we believe it's due to the stigma and of course just that mistrust in getting that healthcare that within the traditional system.
I still feel like we have such a long way to go in this. Yeah, thanks, Grace. I appreciate it.
That's all your questions, Councillor Jowett?
Yep, just trying to get my head around why we're getting all these calls with these people who have frostbite and we can't get them to come in, Karen. We're trying so hard, and there's been so many in February.
Chris, I'm putting you on the spot here, but it seems to me that it's homelessness and unsheltered people and people that aren't going into our shelters. Do you want to comment on the frostbite issue at all?
Yeah, thank you, Chair Redmond. Through your Chair Redmond to Councillor Jowett. Yeah, we've had multiple discussions often on Friday nights and early Saturday and Sunday mornings around concerns about individuals who are unsheltered or living rough in our community and not accessing spaces. And the piece that I continue to go back to is the core of the support work of street outreach and emergency shelter is the development and establishment of relationships with members in our community who are experiencing unsheltered homelessness. That relationship leads to trust and engagement and consent and allows for a better connection and better connection into shelter or ultimately housing services. We know that housing is the answer to homelessness, and as a community that believes in housing first, we have a well-coordinated access system to get folks into supportive housing and housing with supports and then other housing opportunities. And so continues to be a challenge, not like other communities across Ontario and across North America struggling with this. And we continue to look at best practices and research with our colleagues across North America to see what more we can be doing. And so we continue to challenge ourselves to do more and do better. And I would go back to the core and the heart of it is those relationships that street outreach and shelters develop with folks.
Thank you very much for that, Chris.
And kind of an interesting phenomenon, Karen, that we've been finding is this trust building thing, and then they want the outreachers to be punitive and force them, so we're trying to get messaging out there that is absolutely incongruent with building relationship trust, using force to make people do things, right? And there are community members who are hysterical about these cases of frostbite, and they have these expectations of us being a lot more assertive. And I said, but it's not congruent with building the trust. All we can keep doing is keep making the ask. And even the shelters, like Diane McLeod over at the food bank has offered to take their stuff in and protect it so they can get in a cab. We've changed the ability to go and get a cab anytime you want, if transit's not working. So there are on the street nuances that are happening that I think are helping make a difference. But there's still so many of them that we just can't seem to get at them. We just can't seem to get them to come in, and they're literally using lighters to keep themselves warm. And it's very high acuity people, and I just really worry. The frostbite thing it's scary. Thanks, Chris, for all that you're doing here.
Thank you, Councillor Jowett. Councillor McGarry, please go ahead. You have the floor.
Thank you, and I really appreciate and certainly concur with my colleagues that are worried about this. Just wondering what And if this data that we can get over the next few months can do in supporting us as councillors, as heads of council, in trying to get more services into Waterloo region for these individuals. And particularly, as you know, Cambridge is coming up to a discussion about a possible site for a consumption treatment service. I know that we in the region are supportive of safe supply. So I guess my main question is, the data that we achieve over the next few months, will that help?
I don't know if we've lost Councillor McGarry, but will this help in making our case for more supports, safe consumption as well as safe supply? Over to you, Grace.
Yep, through you, Chair Redmond. Yeah, I think you're right, Councillor McGarry. I think that the collection of this data is going to add to the picture that we have already regarding the need for those types of services, consumption treatment services, as per the process that City of Cambridge is following currently. But it may also reveal the need for other services. And specifically with this project, we're looking at what harm reduction strategies, supports, anything within the harm reduction program scope that we can offer to provide some fairly quick and substantial support within the shelter system now. So that's the main focus, but I do believe that the data will likely be helpful for other reasons.
Councillor McGarry?
That's perfect. Thank you.
Thank you. And again, Chris McAvoy, I don't know, do you want to comment from the housing piece and how it could impact our services?
Yeah, thank you, Chair Redmond. Through your chair to Councillor McGarry. As Grace said, I think there are a number of different avenues that we could move forward with, depending on what the data and information is telling us coming out of this needs assessment. There are a current number of strategies across both housing and homelessness sector for the provision of harm reduction supplies and materials and support to staff. What we're hearing is what we're doing is not enough at the moment. And so we want to understand from direct service staff, from shelter organizations, what more could we be doing? And so getting that data, that information back in will help inform those next steps to be able to plan accordingly to meet whatever gaps we find.
Thanks, Chris. Councillor McGarry, any further questions or comments?
Yes, and hopefully you can hear me. There are some in my community that suggest that harm reduction is helpful to assist individuals, and our comment that you can provide just about how important harm reduction is, and that there's a number of tools that sort of make up an overall harm reduction strategy in our community.
Okay, Grace.
So you did cut out a little bit for me there, Councillor McGarry. So I'll try my best to answer that question. Yep. So I think what I heard you say is, how do we talk about harm reduction as being a helpful strategy for folks who are using substances, and how does that fit into the broader spectrum of supports generally around problematic substance use? So I always go back and, the relationship question, or the relationship piece comes up all the time. Harm reduction is about meeting people where they're at, and it's about building those relationships where they may not have existed before, so that those folks who need those supports can, get their needs served in the immediate sense, but they also open the door for people to have broader conversations about other things that they might need in their lives, both in the immediate term, in terms of housing, access to income support, access to other things, and then later on, creating that relationship so that it forms a basis or a foundation for conversations about improving health in the longer term. And so without that relationship, without that strong foundation, it's very challenging to have those conversations with people. These are often people who've experienced a lot of trauma. They've likely experienced a lot of discrimination because of their drug use and other things that are going on in their lives. And so that trust has been eroded over some time. So that, when we talk about harm reduction, we talk about meeting people where they're at in terms of their health needs, but also forming that bridge to other health services or other social services that they might need.
Thanks, Grace. Any further questions, Councillor McGarry? Okay, thank you. Councillor Clarke, please go ahead. You have the floor.
Thank you, Chair. Just building on Councillor Jowett's questions and Grace's response, I think that we need to be clear that this issue of overdoses and overdose deaths isn't happening only in the unsheltered community. The shelters themselves are having overdoses and deaths, overdoses every day, deaths frequently. We had an overdose death in our women's shelter 2 days ago, and our shelter is just a couple of blocks from the CTS. So not to take anything away from the importance of CTSs, but it's not a magic bullet. The response has to have many, many, many pieces, one of which is safe supply. CTS is certainly part of it. But I think that we really can't simplify this too much. It's a very, very complex problem and will require all sorts of responses.
It really wasn't a question, but Chris or Grace, do either of you want to respond or add to Councillor Clarke's comments?
Yeah, thank you. Through you, Chair Redmond. Yeah, Elizabeth, we are, or Councillor Clarke, we're certainly aware of those overdoses and the deaths, and our condolences to you and your team for earlier this week. Yeah, we're aware of the challenges and hence the need for this work to understand what more can we be doing for staff, for participants, for the system. Because to your point, it's not just amongst individuals. Overdose deaths and non-fatal overdoses aren't just happening with individuals who are on shelter, it's happening within the shelter system. And that's having an impact upon participants and upon staff. And so what can we do? The how might we mitigate and prevent those risks to both participants and staff? And we hope to find out what more we could be doing.
Thank you. Councillor Kiefer.
Sorry, I was muted there. I just wanted to comment on the, on the conversation that's been going on with regards to the harm reduction. And, as was mentioned, I think Councillor Clarke mentioned it, the consumption site isn't the total answer. It's just one of the tools in the toolbox. And I think what needs to happen is that Chris and Grace, if you could comment. I mean, the site, the consumption site in Kitchener, I've heard nothing but good things coming from it, and how it has affected, the area or the people that have been affected. And I think if you can comment on what's going on there and how great that is, I think that's one of the things that needs to be said publicly. I know it has already, but it needs to be said more. Thank you.
Thank you, Councillor Kiefer. Grace?
Through you, Chair Redmond. Yep, thank you for those comments, Councillor Kiefer. I think you are hitting the nail on the head. The what's happening at the CTS in Kitchener is pretty magical. I don't have really a better phrase to describe it as. The staff of Sanguine Health Centre who are operating the site continue to see people throughout the pandemic. They've continued to respond to overdoses in fairly high numbers and increasing numbers over the last little while. It is a little bit of an unsung story at this point. They've just been going about doing their work very quietly. That work has been happening with, very little need for police involvement, very little need for security involvement. It's really been a non-story or a non-issue in terms of the site being open, which is fabulous news. That is the need to share that good news story, we'll say, has been raised by our colleagues at City of Kitchener, as well as our colleagues within the police service. And in response to that, we are working on doing a kind of a rapid review of services for the first year. And so we hope to be able to get that work started soon. But we do think it's an important story to tell, both in terms of how the staff there have been able to meet the needs of clients very easily, very quickly, very quietly, giving the support where it's needed, especially through the last year in the pandemic when people's mental health has been really struggling. The plans are to tell that story, but the the short answer is they have been going about their work, and they've been doing incredible work over the last year and a half.
Thank you. Councillor Kiefer, any further questions or comments?
Oh, thank you very much, Grace and Chris. Thank you, Madam Chair.
Thank you. Councillor Vrbanovic, you have the floor.
Thanks, Chair Redmond. And just, I guess, first of all, to pick up on that, I as a neighbor, I would just like to echo thanks to Grace and the team for the great job that everyone in terms of our partners, but also ongoing liaison with regional staff between Sanguine and the region have been doing at CTS. I think Grace's word is a correct word, magical, in terms of what is happening. You know, as I think as we certainly heard stories around the challenges that would happen, and very few of those challenges have in fact occurred, and the difference that this is making in people's lives, and a reminder that these are brothers, sisters, aunts, uncles, children of people in our community, everyday regular folks like you and I, who are part of that story, and it's pretty powerful. I do want to touch on one community that I continue to have concern on, and it's building on some of the issues that Councillor Jowett and others have raised from a Cambridge perspective, and it is our high acuity individuals that are still on the street. And I've raised this in other meetings as well, and my concern for us connecting with these folks who are often on the move, you know, during the day. You know, we're still seeing some of them finding shelter in the evenings and in store vestibules and so on. And, you know, there are others who are still finding, you know, who are out at remote sites around the city. How are we going to connect with those folks, particularly in terms of the vaccine? I mean, I'm happy to hear that the homeless population has moved into phase 1. That's important. It's something that came up last Friday in the call with the Premier and the provincial ministers, and so it's good news to hear that. But we got some work to do, I think, to get to all those folks, the ones that aren't staying in our shelters. Like, we've done a really incredible amount of work in getting many there, but there's still those that are a challenge. I don't know if Chris or Grace or anybody has any thoughts on that.
Actually, Councillor Vrbanovic, I don't know if that's a fair question to pose to Grace or Chris. They may have ideas about what should happen, but as far as the vaccine rollout, I would think that Deputy Hilton, I don't know if she's still on, would probably be in the best position to answer, or perhaps Dr. Wang.
Yeah, I can say that the task force is working with the service providers that you know these people best and are trusted by them to plan the distribution of vaccine to these groups, so that we can try to reach them as much as we can.
I see Mr. Bartholomew Saunders and I see Deputy Hilton. So Douglas, go ahead, and then we'll go to Shirley.
Through you, Madam Chair, I'd be happy to speak with Dr. Wang and Deputy Hilton about the efforts that community services could make to make the connections to the outreach workers, who would probably be the first line of connection to the unsheltered homeless, and our best way of bringing them into be vaccinated. But I'd be happy to take that up with Dr. Wang and Deputy Hilton and make it part of the discussion of the vaccine distribution task force.
Thank you very much. Deputy Hilton, did you want to make a comment?
Thank you, Chair Redmond. And I just wanted to add that just with this population just being added to phase 1, the discussions are have started previously, but are beginning this week in terms of how to best serve the population by the vaccine, whether looking at mobile clinics, whether we have our shelter system as well. So we are starting very early on with meetings to discuss how to roll out the vaccine distribution to this population. So happy to engage further as suggested.
And then I think, both of those are good ideas. I mean, some of the others, at least from a Kitchener end, I think of things like the Salvation Army truck on Friday nights that maybe is getting population that, is not frequenting in other places. Think of the new food hut that St. Mary's Church has put up and is reaching out to different folks with. And I do think, and I know, this is an issue that I keep speaking about. I do think at some point we are going to need to talk with our service partners around expanded hours of service into the evenings and weekends. And I know there's challenges around that. But I think it's going to be necessary. Like we're a large community, and I think we're getting to that point. So I will raise that again with you, Mr. Bartholomew Saunders.
Thank you very much. And I didn't mean, Grace and Chris, if you want to jump in about best practice or ideas you have, I didn't mean to say you couldn't answer. Do either of you want to weigh into this at all?
Yeah, thank you, Chair Redmond. To echo some of the comments that were said earlier, we've been having conversations with our emergency shelter providers, street outreach partners for several weeks now, as well as consulting with the Housing and Homelessness Working Group, which is a sub-working group of the Community Supports Control Group, around when we do get the green light to move forward with vaccinations for emergency shelters and individuals who are experiencing homelessness. What are some of those best practices? And we see other communities in the United States as well as Toronto moving forward rapidly. And so we're following some of their best practice and looking at some of their thinking. And I'll go back to the relationships and connections piece, meeting people where they're at from both a relationship base as well as physical base. So Councillor Vrbanovic, you've suggested a number of locations that are great ones, as well as St. John's Kitchen, Ray of Hope, some of the other drop-in spaces that we have in addition to emergency shelters. So all of those are strategies and aspects that we're currently planning on.
The other thing that comes to mind, and I don't know if it's much of an issue or not, but is the folks who are collecting at off ramps and so on, collecting coins, and I'm just wondering if that's a place where we should be making some sanitizer available or whatever, just recognizing there's an exchange happening there that maybe, a lot of well-intentioned people, but may not be always the safest, and maybe something for us to take a look at as part of our outreach.
Okay, thank you. If you have no further comments, Councillor Jowett.
Thanks, Chair Redmond. And just quickly, so Chris, because of all of the conversations you and I have had this month, I guess what I'm just going to pose, and maybe don't want to have to answer it now, but what can we do better or different with what's been happening this month? Like I'm really perplexed and at a bit of a loss, and my heart hurts thinking about this. So like what can we do better?
Through your Chair, Redmond, the answer is housing. The answer is housing and housing with supports. Building the connections and relationships through street outreach and through emergency shelter are helpful. The solution to homelessness is absolutely housing. And I know that we're working closely with our municipal partners on a number of different actions and activities to get more access to housing with supports, affordable housing, accessible housing. So that is my very short response, but I know it also takes a long time to make those pieces come to fruition. So in the meantime, it's the development of establishing those trusting relationships, consent and engagement, ultimately towards housing outcomes.
It's really feeling like it takes a village to get them to feel trust sometimes. Like these are like this one gentleman's been out since 2010, and we are trying absolutely everything and can't get him to come in. Like that's, I know there's 100 cases out there. I'm not trying to monopolize by one case. I'm just perplexed as to how somebody can stay outside knowing that they've got such bad frostbite and they could likely not make it through the night, and we just can't get them. We just can't get to them. Like,
so I see no other speakers.
Not much more.
And Councillor Jowett, I think you raise a really good point, and that is that it's been said repeatedly, whether we're talking about our initiative about dealing with the pandemic in public health, if we're talking about the vaccine rollout, we're talking about opioid addictions, which we know are rampant across our country, and talking about housing. As much leadership and fine staff that we have in Waterloo region, no one level of government can do this, and no government can do it. And it really is our community partners that animate a lot of the programs and the services that we're charged with providing. And I think our history of collaboration and cooperation will continue, and we will try to meet these challenges, although they do evolve and they're very complex. I don't know if you have a final comment you want to make?
No, I don't mean to belabor it. It's just been a bit of a tough go, but thank you. Thanks for the indulgence.
Councillor Foxton.
Thank you, Madam Chair. And I'm aware that all of this takes time, but between today and that time, what can we as citizens do? And I've been sitting here thinking and listening to all of you and Councillor Jowett as well about the horrendous things that she's seen. Maybe when we see them at the corners and under the lights with their signs. There was a thing put out a while ago where you're having socks and mittens and stuff in a Ziploc bag in your car, and you toss it out to them. And maybe those pants, you know, the one size fits all, the big baggy pants that are lined on the inside and waterproof on the outside. And if we could all do maybe a little bit of that, I mean, just to get us to where we can take care of them better. And warm lined gloves or dry gloves or anything we could do. And I'm saying this not to councillors, I'm saying this to the public. We got to do what we can, because there but the grace of God go I.
All good ideas, and I would go back to one of the comments that Councillor Vrbanovic made, and that's a smile and how are you doing, and treating people like they are fellow citizens on the same journey the rest of us are all on is a very low cost way to bring humanity to every corner of the region. We're all very philosophical tonight, aren't we? I see no speakers. Thank you very much for all of your, Mr. Lochner, do you have a comment?
No, I just had another item to add quickly when it's appropriate.
Go right ahead. I was going to take a motion to adjourn, so you're just in time.
So thank you. Just before we adjourn, I did want to acknowledge that there's an individual on this call today, and this is their last Board of Public Health meeting. This individual started with the region 40 years ago when they were 3. Karen Quigley-Hobbs has been a great member of the team. Karen started as a public health nurse in 1981 and led a wide range of initiatives in areas in public health. And I certainly had a chance to work with Karen over the years in another capacity. And I'm grateful for her patience, for your patience, Karen, for your wisdom, for your advice in the health system. And I'm going to miss you, and I know your team's going to miss you. I just want to acknowledge your work publicly, and thought this was a great way to do it at the Board of Health meeting. So thank you, Karen, and enjoy retirement.
Thank you very much. Appreciate it.
Dr. Wang, do you want to make any comments? And Karen will give you the last word after Dr. Wang.
Yes, I too want to express my enormous gratitude to Karen. You know, I've had the privilege to work with her for 17 years now, and I've learned so much from her. In fact, I have a nickname for her. It's Boss, because you know, she showed me you know, how to be a great boss. And I'm just tremendously, well, on one hand, sad for us, but on the other, so happy for her, because after contributing 35 years to public health and to countless staff and students in our public health department, and also to the community at large, with all the things that she's done. Her list of accomplishments and attributes is really too long to go over in 30 seconds. It just is going to be a great loss for us, but it's just so wonderful that she's finally going to be able to enjoy most deservingly a most well-deserved retirement. And we're just hopeful, she'll continue to talk to us after she retires, and we can get together again when we can gather again with friends. So thank you again, Karen, and all our best.
So Karen Quigley-Hobbs, we will give you the last word.
Oh boy. Thank you, Chair Redmond, and thank you, Council. It's been a privilege to be part of the regional family for so many years, and have had the honor of working with a number of MOHs, a number of CAOs, and well, 3 regional chairs. And I do thank you for all the support that you have provided over the years. And it's been, as I say, a privilege to be part of the regional family. And I know that things are going to continue to be great in the region. And thank you again. It's been really a great experience. I am one of those people that have only worked for the region ever. So I think I'm a dinosaur of my times. So thank you.
I don't think you're a dinosaur. I always felt like you were my training wheels when I became chair, and we went on our road trip with Grace and a few other public health officials, looking for CTS locations and talking to the community. So you will be greatly missed, but every success in the next chapter for fulfillment and wherever your dreams take you.
Oh, thank you very much, Chair Redmond.
So on that high note, it's moved by Councillor Jowett and seconded by Councillor Kiefer that the Board of Health now adjourn. So I'd ask you to use your icons. Thank you, colleagues. Have a great evening.